Alarming new research may tell us why Houston is seeing such a high spike in coronavirus cases, with Houston's Texas Medical Center reportedly at 105% capacity. Researchers at Baylor College of Medicine say a strain of the virus in that area has mutated and has become even more contagious than what we have seen so far. Joining me now, Dr. Cedric Dark, emergency medicine physician and assistant professor at Houston's Baylor College of Medicine. He is also the founder of Policy Prescriptions and a board member of Doctors for America. Doctor, thank you so much for being here with us today. We have been following a number of states that have seen the spike in cases along the Sun Belt. If you could just give us some insight to start the conversation about what you're seeing there in Texas and more specifically in Houston.
Well, yesterday was Texas's deadliest day of this pandemic. Over 100 people died. And I've seen reports that refrigerated trucks are coming to Texas to be able to handle bodies because there are not enough spaces in the morgues. This is something that I experienced one other time back when I was in medical school, 2001, during 9/11. I actually went to medical school in New York, and from my 14th floor, I could see down onto the office of the chief medical examiner, and I could see rows of refrigerated trucks, a white tarp, that carried the bodies of the people that were killed in the collapse of the Twin Towers. But just to put it in perspective, more people have died in Texas from COVID than those who died during the 9/11 attacks.
And it's something particularly scary because we're hardly close to the end of this at all. And now we're seeing this new research. So this is the Los Alamos National Laboratory. They've discovered a mutation of the virus that facilitates its spread. Joseph Petrosino, who's the chair of molecular virology and microbiology at Baylor College of Medicine, he said that the one we have in the U.S. spreads better than the original that originally emerged in China. So what does this mean for Houston, for the Houston area, potentially for the country?
Well, it just means it's so much easier for the disease to spread and for more people to get infected. And what that really means is that people need to take this seriously. We need to really make sure that everybody's masking up when they're out in public. People need to socially distance from people that aren't in their homes, because if we don't, we're going to lose control of the virus. And you see what's already happened in Texas. We actually had a pretty good grip on it earlier on in the pandemic in April and going into May, until we reopened our economy at a breakneck pace. Once we did that, cases started going up dramatically, increasing over the past 2 to 3 weeks, almost at an exponential rate. And so now we're trying to get a handle on it again, to the point where the governor had to reissue a mask order. But in that interim, there was a period of about 67 days where the governor prohibited people in Houston from issuing our own mask order until he was forced to do it himself for the entire state.
Your thoughts on the suggestion that there should be a nationwide mask mandate versus this being done state by state?
I mean, I think that healthcare is best delivered very, very locally. And so, what we should be doing is trying to have decisions made by local politicians at all costs if we can. I think it's a mistake for someone to come in and overrule what the local politicians want to do if that means they want to mask. And, if it becomes necessary, as it became necessary in Texas for the sake of public health, yes, then we need a mask order. Whether or not we need one nationally, I think at this point it should be a state-by-state decision. But if it gets to the point where it's overwhelming the entire country, then I would call on the president to make that order as well.
Houston, among other cities in the South, in Arizona, some in Florida, have been described as hot spots. How do you climb out of that? What is the strategy? What do the people need to do? What do the providers need to do? And also the government, the politicians that are speaking and working to inform the people?
I think we need consistent leadership all the way from the top down. And as I said before, and I'll reiterate now, masking, social distancing, and taking this coronavirus seriously is what we definitely need to do. One of the other things that we have to realize is that our treatments in the medical field are fairly limited, right? We have oxygen that we can give to patients. We have antiviral remdesivir that we can give to people to shorten their hospital stays. Dexamethasone is showing to be a promising treatment for people that have damage to their lungs. But when it comes to the simple interventions, something as easy as oxygen, you have to think about how much does that cost for someone to actually take care of that at home. I was looking up how much is an oxygen concentrator. It's somewhere on the order of hundreds to maybe $1,000, $2,000, $3,000 for that machine. What do you do in Texas, where you have 18% of our population uninsured? how are we going to make sure that people that need such a simple therapy actually have access to it? And so what I would say right now is we have a moral imperative to one another to address things like the social determinants of health, things like uninsurance, so that people that are infected, people that are sick, can get the care that they need so that they can recover and return to being functional members of society.
Absolutely. Dr. Cedric Dark, a very important point made there at the end of the conversation. Appreciate your insight. Thanks for joining us.